Okay, so we are talking to Maurie Wheatley today, and Maurie has been in orthotic therapy, or what most people would call splint therapy, since November.
Yes.
So Maurie, would you be kind enough to just talk to us about your dental history, where you've come from, how this has progressed, and where you are today after doing orthotic therapy with us?
Sure. It started several years ago, probably back almost 10 years ago. I had several caps that had to be put on due to pulp stones, and so that was work done that changed sort of the bite of my mouth. The doctor tried to, get them where everything would match back up. But that's when I noticed things starting to go not quite right over the years, and it took several years before I noticed anything such as that. But it went from that to I couldn't chew gum. I would notice a lot of soreness in my jaw. And then later it went from that to not being able to eat chips or lettuce without just having a lot of jaw soreness. So I saw two other, not orthodontists, but maxillofacial surgeons. Both gave me splints. One was a hard plastic, the other was a flexible plastic. Neither worked. We tried over a duration of time, and that would be just wearing it at night, not all during the day. Then it just has gradually gotten worse over the years. The things that I would eat would irritate the jaw, such as cereal, salads, anything that you really had to chew hard, certain meats, or crunch, anything that was really hard to the touch. And so it would just irritate the jaw to where I would feel soreness along my ear, along my jawline, and behind my ear. At times I would relate it to a migraine headache, but later on I realized that is not what it was at all. And probably in the last 2 years, maybe 3, I would not even know how I'd wake up in the morning. And that's when it became so serious that I thought, I can't live my life this way anymore. I wouldn't know, I could go to bed fine, and I would wake up and my jaw would be so sore, and it would be such an excruciating headache that would radiate up the side of my face and down my neck and into my shoulders, to the point of I couldn't get out of bed. My husband would have to stay home from work, and I felt like a failure, as a mom and trying to take care of everything, but there was really no relief. And I tried my migraine medicine, and it would help a little bit, but that was when I knew at that point that it was not a migraine headache. It had to be the TMJ. And so I began searching and just trying to see other things that could be done, and I wasn't finding anything until I talked to Paul. And he said that he had gone through a class and worked with a guy in Dallas, and I said, I'm ready for it. I want to try it because nothing else has worked, and I cannot continue to live like this. When you don't know whether or not you're going to wake up and be able to function for the day, or is this going to be a day that you can't get out of bed until 3 o'clock? And then at that 3 o'clock, you've taken so much medicine to alleviate the pain and the stress on the jaw that it's not a good day anyway. You just want to lay down and go to sleep. So this has been life-altering for me. Since November, I could count on one hand that I've had 2 headaches, and they were mainly due from muscle, from moving boxes actually. We moved to Florida, so that had a little bit to do with it, and I do not think it was anything related to jaw. But the splint fits really well. It's awkward at first, but Paul adjusts it to where it's very comfortable to wear, and it just becomes a second part of your body, of your mouth. And it really has helped, and I would recommend this for anyone who's suffering with TMJ. Do not wait. It's been life-altering is all I can say. So.
Oh, all right, perfect. So today we're going to begin the final process of doing a little rejuvenation and getting you restored so you can say goodbye to your orthotic.
Awesome.
All right.
Looking forward to it.